Hi, this is Dr. Abhinav Jain from Gastroenterologist Hospital, Ahmedabad, India. In this lecture, we'll be focusing on the lifestyle changes which are required for patients with fatty liver disease. Fatty liver disease has two main causes. Number one is alcohol, which we'll not be covering in this lecture, and the second, more common, is the non-alcoholic fatty liver disease. Now, the new name of this is metabolic dysfunction associated fatty liver disease, and this is as common as 1 out of 4 people. The risk factors for NAFLD or MAFLD are diabetes, hypertension, thyroid problems, being obese or overweight, especially having fat in the abdominal area, high triglyceride or cholesterol, a strong genetic or family history of liver disease, sedentary habits, heart disease, polycystic ovarian disease, and even certain medications. Now, fatty liver, it progresses from a normal liver to a fatty liver where there is fat infiltration within the liver, and this progresses to steatohepatitis, also known as NASH. In NASH, the fat infiltration has now led to inflammation, and this leads to increase in the liver enzymes like SGPT and SGOT. The damage is measured by the amount of collagen deposition that occurs in the liver. F1 is very mild collagen deposition, F2 and F3 progressively higher, and F4 is also known as cirrhosis. Cirrhosis is when cirrhosis is when the liver is completely replaced by scar tissue. Cirrhosis is considered as an irreversible damage to the liver. This process can take years and even decades to happen. The lifestyle changes are focused on two main things. One is dietary change and second is exercise. The goal of these changes is weight loss, which is about 7 to 10% of the body weight. But there may be some lean individuals who are not that obese but still have fatty liver disease. For them, the weight loss goal is slightly lower at 3 to 5% of the body weight. The principle of the diet changes is calorie restriction. Approximately 500 kilocalorie per day or 20% of the total daily calorie intake is to be restricted, whichever is higher. So we go to the macros first. Fat. We have to decrease the intake of saturated fat. The examples include butter, ghee, fried foods, biscuits, cake, cream, meats with high fat, ice cream, products made with palm oil, whole fat dairy products. And we have to consume high unsaturated fat, which includes omega-3 and omega-6 fats. An example of this would include almond, hazelnut, peanuts, avocado, pumpkin or sesame seeds, fish and fish oils. These are the healthy fats. So no to saturated fats and yes to unsaturated fats. Carbohydrates, they can be consumed in moderate quantities, but we have to avoid fructose, sugary products and processed or packaged foods. Other examples of this include sodas, colas, candy, packaged fruit juices, ice cream, pastries, sweets, jam, ketchup, etc. Protein. Patients with fatty liver disease need a high protein diet. A maximum of approximate 1 gram per kg per day with routine activities is recommended. The preferred sources should be vegetarian, although for those who take a non-vegetarian food, eggs and white meat can be taken. White meat would include fish and chicken. Other examples of high protein diet would include milk and milk products, soya, tofu, cheese, cottage cheese, pulses. And it is important to avoid red and processed meat. Although this meat does consist of a high amount of proteins, but they would also consist of a high amount of saturated fats. Fiber is useful for these patients from a general health point of view, but no specific benefit is there in fatty liver disease. So I do advise my patients to consume a high fiber diet. Probiotics, curd and buttermilk are helpful for any patient with liver disease or from any cause. Various commercial products of probiotics are also available which can be consumed. Coffee has been found to be helpful in patients with fatty liver disease, but still it is difficult to recommend patients to start taking coffee for those who are not taking it already. So it is controversial, you might find this on the internet, but I would advise not to start coffee just for the benefit in fatty liver disease. Salt has to be taken in very small quantities, only less than 5 grams per day, especially if the patient has developed cirrhosis of the liver. For cirrhosis specific recommendations, there is a separate video on my channel. A number of special diets are now becoming popular, like keto diets, intermittent fasting or Mediterranean diet. Now, all of these diets have the common thing of calorie restriction and producing weight loss, but all of these diets may not be safe in patients with advanced liver disease, and this should be done only under medical supervision. Mediterranean diet is the one which is recommended by the European Society for Liver Disease. It is based on plant foods and olive oil. Coming to physical activity, which is the second aspect of lifestyle modification. The WHO recommends at least 150 to 300 minutes of moderately intense aerobic physical activity per week, or if you are doing vigorous intensity exercises, then at least 75 to 150 minutes per week. So what does this intensity mean? Light intensity would include slow walking, housework like cooking, gardening, playing with children, etc. Moderate intensity would consist of brisk walking, where you walk at a fast pace, cycling, hiking, sports like tennis, yoga, swimming, etc. And vigorous intensity would include running or jogging, walking uphill, skipping rope, aerobics, gymnastics, intense swimming, and sports like football and hockey. For additional health benefit, at least 2 days a week you should indulge in muscle strengthening activities, which include lifting weights, yoga, calisthenics, and bodyweight exercises, or by using resistance bands. There are a number of channels on YouTube for which you can learn these exercises, and this can be done at home if you do not wish to join a gym. Also, it is important that we limit the amount of time which is spent in sedentary habits and replace them with some or other physical activity. For example, when you're talking on the phone, you can walk at the same time, or instead of taking an elevator, you can use the stairs. But remember that any physical activity is better than no activity. Even if you're not able to reach the goal because of some bone or joint issue, or because of your age or your heart condition, even if you are able to do some physical activity, that is better than doing no activity. You should start slow and gradually increase the intensity. Consult with your doctor if you have any major diseases which limit initiation of any exercise program. And always remember, the key to success is sustainability. Carrying on lifestyle changes over long periods is helpful, even if they are of small changes. When you start slow and progress over time, gradually you will see the benefit. Remember, your fatty liver disease has taken not weeks or months, but years or maybe even decades to come here, and it's not going to get reversed over a few weeks to months. It will also take a long time. Start the physical activities which you enjoy doing. For example, if you go and join a gym but you don't enjoy it, there's no point in it. If you enjoy dancing, if you enjoy swimming, if you enjoy cycling, then do those things. For the diet recommendation, add foods which are locally available or which are already a part of your cuisine or a culture. Going for exotic foods which are not locally available is not going to be sustainable. And avoid radical changes in lifestyle. It is possible to have small changes in your lifestyle over a long period of time to produce the same benefit. Remember, when you have changes over a short period of time, you will be successful, but then when you are not able to sustain it over months or years, slowly you are going to get to the original weight again. Thank you for watching. Please subscribe for more videos.